We will then continue with Dr. Sylvain Algiri, Head of Epidemic Response Team of the PEO and WHO.
Muy buenos días. Soy Sylvain Algiri. Yo soy el director adjunto.
Good morning. I'm the director of the PEO in Washington, and I have the honor to represent PEO and WHO today. I would like to greet the President, Sebastián Piñera, and all ministers present, and also the virtual delegations and those who join us over Zoom today. I would like to highlight from everything that has been said among the ministers, Colombia, Chile, Ecuador, and Uruguay, some very important aspects. First, how vaccines have saved lives. Such as the health minister of Colombia said. He shared some data, 22,000 lives saved just last year. And then from July 21, the impact of vaccination in South America and then Central America after some months is very obvious. Mortality rate in 60-year-olds has decreased a lot from the moment the required coverage was reached, as I said, first in South America and then in Central America and the Caribbean. Second aspect that I would like to point out, that several ministers have said, which is coordination among the sectors to manage bed capacity. This is very important to save lives as well. And the third point I would like to point out is concerning Dr. Salinas' presentation, which is surveillance. Also, molecular surveillance, which means development of labs and new technologies and tools to manage this pandemic, which means that in this context, I would like to remind and point out what our director said in her introduction, that we are now in 2022 in a situation that on a global and region and sub-regional level and subnational level, we're experiencing a transition period from acute response to sustained control. And the most important points of the honorable ministers, I would like to stress three of them. Of course, there's still a lot of work to do to contain and expand surveillance and genomic surveillance, of course. We have made some achievements that are really exceptional, and we have a very big regional network that has allowed us to control SARS-CoV-2. And right now, through participation of all countries and academia, I would like to point out 8 laboratories that have helped colleagues and their brothers countries. The second point is there's still a lot of work to do concerning the clinical aspects, which means providing services and our health systems to support patients with new therapeutical methods that we have incorporated recently, new protocols that we keep updating. And finally, I would like to stress this very big vaccination campaign And of course, the investment in human resources and finance to buy these vaccines for all citizens. But there's some countries on a regional level that we already know that will probably not reach vaccination goals. So we have to focus on those countries and support them. At the same time, we have to orientate groups of the population which we have not been able to reach until now. There are still citizens, adults, that have not received their first doses in many countries of the region. So this is one of the main concerns. And of course, we have to take actions for risk communication to convince people that have had some kind of issues or concerns concerning vaccination. We have to lower mortality rates and protect their loved ones. I hope I could sum up in a short time what I thought are the priorities we are seeing during this exchange. And from my point of view, from the POA, and thank you very much. It has been an honor to join this high-level exchange.